Hello, everyone. My name is Regina, and I just wanted to talk to you for a brief moment in regards to immobility. I want to also discuss the healthy ways that you can avoid the effects of it. But first, let me start off by explaining what is immobility. According to medical dictionaries, immobility is defined as a state of being motionless and the inability to move or be moved. This condition can be the result of unexpected injuries that result in temporary or permanent paralysis and may also follow post surgical procedures as well. A very common way to treat and avoid permanent immobility is by first avoiding taking unnecessary risks to one's health by not participating in unhealthy activities. Another very common way to avoid immobility is offered through physical therapy services. Oftentimes, following a medical diagnosis or surgical procedure, this form of care is recommended by doctors and surgeons and is offered in many medical facilities. By taking advantage of these types of services, one can greatly increase the healing rate of an individual by decreasing inflammation, strengthening and toning of the muscles, and promote tissue and bone repair. During a typical physical therapy visit, a patient may receive massage and heat therapy, as well as learn and perform specific exercises tailored to meet their specific needs. However, prior to injury or surgery, there are many ways one can avoid immobility, such as by ensuring one exercises regularly, eat healthy, and get adequate rest. Besides getting a good night's rest, it's very important to keep in mind how too much rest or the lack of movement can affect immobility. Oftentimes, following surgery or injury, a patient may be placed on bed rest to allow time for their bodies to recover. Although this is a great and greatly needed recovery time, however, if a patient takes too long recovering or has permanent paralysis, a condition causing pressure ulcers can develop. Pressure ulcers are also known as bed sores and are a condition in which develops following a person spending long periods of time in one position. Basically, what happens is there is a pressure that builds up in vulnerable areas, such as the heels of the foot, the buttocks, alongside the thighs, and these are common ailments found in facilities such as nursing homes or hospice homes. Um, Ways to avoid bed sores would be by turning the patient every so often, rotating positions, sitting them up, laying them back, and also in many medical facilities there is machinery, mechanical devices in which that can be placed on the legs, which actually gives a massaging like pressure that helps with the flow of blood and and keeping that area active with continuous blood flow and cell production. However, this condition can be avoided also by making sure that that the patient is able to get out of the bed as soon as they possibly can and resume back to regular activities. In the meantime, it is also just as important to remember that diet plays a major role in the healing process and to maintain a healthy physical state as well as avoiding the effects of immobility. A diet that includes foods that are high in calcium, vitamin, and vital minerals can reduce the rate of broken bones and ailments such as cancers that may result in immobility and require future surgeries. Foods or vitamins such as vitamin D has been found to be a necessary aid in the absorption process of calcium, which both have been found to promote strong and healthy bones as well as muscles and tissues. Without the vitamin D, the body cannot actually absorb that vitamin, and the body will begin to suffer from calcium deficiencies. Vitamin D can easily be found in foods such as fish and eggs, and is also found as well in nature. By doing simple outdoor activities, one can take advantage of receiving an adequate dose of vitamin D just by spending as little as 5 minutes a day outside. As I stated again, vitamin D as well as calcium helps to promote strong bones and muscles. And and calcium can be found in herbs such as basil, marjoram, dillweed, thyme, and all herbs. Um, These are all herbs that are high in that quality. Along with eating healthy, one must consider finding physical activities that they can enjoy outside, as I previously mentioned, such as gardening, participating in sports, such as golf, basketball, and swimming, or taking simple walks or jogs in the neighborhood. Again, these exercises can greatly decrease the rate of injury and immobility. By participating in those outdoor activities, again, one is able to absorb vitamin D directly from the sun. So it's not something that's necessarily that we have to go out and purchase. It is freely provided to us through nature. Also, by participating in exercises such as yoga and martial arts, which require little to no equipment, is also a great benefit when considering ways to execute a healthy lifestyle, as well as, again, avoiding immobility. Those example exercises will help in conditioning the body and help with maintaining healthy bones, muscles, joints, as well as vital organs. So that was my lecture, my very brief lecture today in regards to immobility. But of course, if you have any further questions or concerns, feel free to reach out to me at visionqueenboutique.com. At gmail.com. Again, that's a vision, that's VISION, Queen, QUEEN, boutique, BOUTIQUE, at gmail.com. There I'll be happy to address any questions or concerns, and I do try to respond to my emails within a 24-hour period. Again, I thank you guys for your time, and I hope everyone has a very great day. Bye.